Repair and Rupture in the Therapeutic Alliance. The Therapeutic Alliance, a cornerstone of effective psychotherapy, thrives on a dynamic interplay between repair and rupture. This intricate dance is not merely a backdrop, but a focal component of therapy's transformative power. Central to this dialogue are the intricate processes through which therapists and clients navigate the terrain of interpersonal missteps, mismatches, and misunderstandings, collectively known as ruptures. The subsequent repairs demand a nuanced understanding of both theoretical frameworks and practical strategies, allowing for the re-establishment of trust and the deepening of therapeutic engagement. The theoretical underpinnings of repair and rupture within the Therapeutic Alliance are multifaceted. Bordin's model of the Therapeutic Alliance, which emphasizes goals, tasks, and bonds, provides a foundational lens through which these processes are viewed. Ruptures typically manifest as disruptions in these areas, whether through misalignment in therapeutic goals, disagreements on tasks, or weakened interpersonal bonds. Contemporary attachment theory further elucidates the mechanisms of rupture and repair. It posits that patterns of attachment influence how clients perceive and respond to relational strains, thus shaping their expectations of therapist responsiveness and attunement. From a practical standpoint, the ability of a therapist to effectively navigate ruptures is contingent upon their skill in attuning to the client's experience and deploying strategies that foster repair. One critical aspect lies in the therapist's capacity for metacommunication, explicitly addressing the rupture within the therapeutic relationship. This involves identifying and verbalizing the mismatch, thereby inviting the client into a collaborative process of exploration and resolution. Research indicates that successful outcomes often hinge on the therapist's ability to tolerate and validate a client's negative emotions, such as anger or disappointment, which are frequently elicited during ruptures. The therapeutic process of repair is not solely an exercise in verbal negotiation. It encompasses nonverbal cues, emotional attunement, and the therapist's authentic responsiveness. The therapist's presence and ability to convey empathy and understanding can significantly impact the repair process. Furthermore, the utilization of reflective listening and the capacity to own and apologize for therapeutic missteps contribute to solidifying the alliance. These strategies are underpinned by an overarching commitment to maintaining a sense of mutual respect and collaboration, which is vital for fostering a resilient therapeutic relationship. Contrasting perspectives on repair and rupture offer additional layers of understanding. While some approaches emphasize the inevitability and even necessity of ruptures as catalysts for growth, others caution against overlooking the potential for harm if ruptures remain unresolved. For instance, cognitive behavioral frameworks may prioritize the rectification of cognitive misunderstandings as a primary mode of repair, whereas psychodynamic approaches might delve deeper into the emotional and unconscious content underlying ruptures. The strengths and limitations of these approaches are contingent on the therapist's ability to flexibly integrate cognitive restructuring with emotional processing, tailoring interventions to the specific needs and dynamics of the therapeutic dyad. Emerging frameworks in the field of therapeutic alliance expand upon traditional paradigms by introducing innovative conceptualizations and methodologies. The application of mindfulness-based practices, for example, has gained traction in addressing ruptures. Mindfulness cultivates present-moment awareness and non-judgmental acceptance, enabling both therapist and client to approach ruptures with increased openness and reduced reactivity. This can facilitate a more adaptive engagement with the therapeutic process, enhancing both repair and overall alliance quality. A novel case study exemplifying the application of these principles involves a therapeutic dyad, where a client with a history of relational trauma experienced a rupture following a perceived misattunement from the therapist. The therapist utilized mindfulness techniques to ground themselves in the moment, allowing for a measured and thoughtful approach to the rupture. By integrating reflective listening and metacommunication, the therapist facilitated a dialogue in which the client felt heard and validated, leading to a successful repair that strengthened the therapeutic bond. In contrast, another case study examines a dyad in a multicultural setting where cultural misunderstandings led to repeated ruptures. Here, the therapist adopted an interdisciplinary approach, drawing on cultural competence frameworks to enhance their understanding of the client's cultural background and relational norms. By leveraging this knowledge, the therapist was able to navigate ruptures with greater sensitivity and efficacy, ultimately fostering a more culturally attuned and resilient therapeutic alliance. The analytical depth required to navigate repair and rupture in therapy extends beyond mere technique. It involves a profound understanding of the client's internal world, the relational dynamics at play, and the broader contextual influences that shape the therapeutic encounter. This holistic perspective underscores the importance of integrating insights from adjacent fields, such as cultural studies, neuroscience, and attachment theory, to inform a more comprehensive approach to repair and rupture. As we consider the interdisciplinary implications of repair and rupture, it becomes evident that these processes resonate beyond the confines of individual therapy. They echo in organizational settings, educational environments, and community interventions where the principles of relationship building and conflict resolution are equally pertinent. The ability to repair ruptures and strengthen alliances in these contexts can contribute to more effective collaboration and enhanced outcomes across diverse sectors. That's it. In conclusion, repair and rupture in the therapeutic alliance represent a dynamic interplay that is both complex and essential. Theoretical insights, practical strategies, and interdisciplinary considerations coalesce to inform a nuanced understanding of these processes. By embracing the challenges and opportunities inherent in repair and rupture, clinicians can foster deeper connections, facilitate healing, and ultimately enhance the efficacy of therapeutic endeavors. Pause.